Hello, my dear students. Nice to see you back. Okay, I hope you've been enjoying my classes. For the last, I've been uploading quite a few. I hope you're enjoying them. I would love a feedback on on my earlier lectures. Okay, and let's now today talk about the thyroid gland. Are you ready? You want a cup of coffee? Okay, so keep yourself comfortable. Next 20 minutes, we are going through the thyroid gland. Okay, happily remember. Okay. So see, thyroid gland is a topic that's a little long to finish in 20 minutes. So what we're going to do is we're going to take it as thyroid gland 1 and thyroid gland 2. So what is thyroid gland 1? In 1, I'm going to just cover the gross anatomy and related applied anatomy. And in part 2, we will be covering blood supply, nerve supply, and little bit of development as well. Okay. So let's begin. Let's introduce the thyroid gland to ourselves in this first lecture. Okay. Before that, as usual, I want you to see where you are. Okay. So see if you can solve this MCQ. Following pairing is correct except superior thyroid artery, external laryngeal nerve. Inferior thyroid artery, internal laryngeal nerve. Internal laryngeal nerve, superior laryngeal artery. Recurrent laryngeal nerve, inferior thyroid artery. Oh my God, this is getting too much, isn't it? Okay, right. Then there's some more. Full question on thyroid gland where you're asked to cover gross anatomy, blood supply, microscopic structure, applied anatomy, and so on. By now you've realized, unless you know this topic, there is no way you can solve these questions or attempt to solve them, right? So let's get that knowledge, students. It's not difficult, okay? Chalo, let's start. Right. So, gross anatomy of thyroid gland. First, what is this gland? Students, it's a unique gland. Okay. It's one of the few glands in the body which depends upon external environment for the raw material of its hormones. Okay. It's also a gland that stores the secretion and releases it as required. It's a gland which has massive blood supply. And finally, it's an endocrine gland that secretes T3, T4 and calcitonin. Okay, so it's a unique gland. We know it's endocrine. We've introduced it to ourselves. Okay, so let's talk about its parts. We know that it's a gland in the neck, okay, made up of 2 lobes and an isthmus. It's almost H-shaped, okay, right, weighing about 25 grams. Now we come to dimensions. Students, how to remember the length, width, etc. Always remember, when I was a student, I would use my common sense. I have seen the gland. I know it's about 5 centimeter in length, about 2.5 centimeter in width and depth. Fine. What about the isthmus? It's about 1.2 centimeter width and height. Fine. Use your common sense. There's no point in mugging up all this. Right. What is the extent of the gland? Where exactly will I find it? Now this matters. Okay. At the level of cervical vertebrae, remember, it extends upwards till the C5 and it extends downwards till the T1. That is first thoracic vertebra. What about the cartilages? See, we are basically dealing with the cartilages. Nobody's going back to see the vertebral levels, right? So, cartilages, it extends up till the, see, observe the line, till the oblique line on thyroid cartilage, and inferiorly it extends till the 6th tracheal ring. Okay, the isthmus itself extends over 2nd to 4th tracheal ring. Okay, now this is important, students. Why is it important? Because now you know exactly where it is. All right, because of the reference of cartilages, you know exactly where your gland is, and that is what is important. So note this. Let's move forward. We're going to study the thyroid gland from outside inwards. So first let's talk about its coverings. If you recall, I have taught you that the thyroid gland is enclosed within a layer of pretracheal fascia. That pretracheal fascia forms the false capsule, and the condensation of the thyroid gland tissue parenchyma itself forms the true capsule of thyroid gland. So you've got a true capsule inside, you've got a false capsule outside. Fine. This false capsule thickens on the inside to form what is called as ligament of Beryl. Now, do one thing. Hold your larynx. Okay. Swallow. Did you feel your larynx move up and down with deglutition? Yes. So now imagine that your entire thyroid gland enclosed in pretracheal fascia is attached to this larynx with the help of ligament of Berry. Every time you swallow, the gland moves up and down with deglutition, which is what the point I'm making here. Okay? So why does it matter, madam? It matters because you have a patient coming with a thyroid swelling. You want to confirm whether this is thyroid or it is something else. Ask the patient to swallow. If it moves up and down, yes, it's likely to be the thyroid gland. Got it? Fine. So what did we learn? True capsule, false capsule. False capsule thickens to form ligament of Berry. Right. Some more about the capsule. As you can see here, this posterior part of the pretracheal fascia is very weak. Okay. Now what happens? You know that thyroid gland has a tendency to enlarge, right? So when it enlarges, it begins to grow posteriorly. Why posteriorly? Because there is a weakness. As it grows posteriorly, did you see how it begins to compress the structures on the inside? What are the structures it compresses? What are the symptoms your patient is going to present with? Okay, so first structure here, that's the trachea. When that gets compressed, patient comes with dyspnea. Okay, difficulty in breathing. Next one here is the recurrent laryngeal nerve. When that gets compressed, patient comes with dysphonia. The last one here is the esophagus. When that gets compressed, patient comes with dysphagia, difficulty in swallowing. Got it? So these are the three symptoms that you might have patient coming with when they have a thyroid swelling. Okay? Right. Last thing about capsules. Now here you're seeing a section of the thyroid gland. That's the true capsule, false capsule. And you can see deep to the true capsule, there's the venous plexus. Now put yourself in a position where you want to remove the patient's thyroid gland, thyroidectomy. Where will you take the incision? You will take it between the true and the false capsule, removing the thyroid gland along with the venous plexus. You can compare this to the prostate gland, where also there's a true and false capsule, but the venous plexus is in between them. So how do we remove prostate? You take an incision below the true capsule. Leave the true and false capsule right there and you just remove the gland. Okay? As you compare, you begin to really understand the necessity of knowing these things. That's why the comparison. Right. So now what have we done? Let's quickly revise. You understood how unique it was. You talked about the dimensions. We talked about its vertebral and cartilaginous levels. And then we talked about capsules and their related applied anatomy. Okay with it up till here? Let's take it forward now. I want to talk about the parts, surfaces, and borders of thyroid gland now. Okay? So as you can see, your thyroid gland is divided into two. It has lobes. You know that there are two lobes. And it has isthmus. Each lobe has an apex and a base. It has got surfaces and it has got borders. Okay? Isthmus again has surfaces and it has borders. That looks like a lot, isn't it, to study? Believe me, it's going to go very nice and easy. Let's first talk about the apex of thyroid gland. That means the upper pointed end. Okay? Right. So here, look at the image. See, can you see the apex of thyroid gland there? This apex is caught between the inferior constrictor on the inside and sternothyroid on the outside. Ma'am didn't understand? Okay, let's do this another way. Take a look at this image now. Can you see the sternothyroid on the outside and the inferior constrictor on the inside? Now see the thyroid gland rising up between these two. Can you see that the apex of thyroid gland is sandwiched between these two muscles? Now see if your thyroid gland decides to expand. Can it go up? No, it can't. So what does it do? It descends down. That's the reason why so often you find patients with thyroid glands hanging in their neck, because they cannot grow up. Okay? So now what is the lesson we are learning here? That thyroid tumors cannot grow upwards. They grow downwards when enlarged. Why can they not grow upwards? Because they are sandwiched between our two muscles. Right. Another thing to note about the apex. The apex of thyroid gland is related to external laryngeal nerve and superior thyroid artery. It's related to both these structures, which are always traveling together. But when they come close to the gland, the artery and the nerve slowly diverge. Artery goes superficially, nerve goes deep. Okay. What do we want to know from this? That when you want to ligate your superior thyroid artery, you will do so close to the gland. Because close to the gland, the nerve has separated from it. Till then, the nerve and the artery were traveling together. Were you to try to clamp the artery, you might end up damaging the external laryngeal nerve. Got it? Right. Let's move on to now the base. What have we learnt? We learnt about the apex, sandwich. Always create keywords. Sandwich, about the apex. Second is two structures traveling together. External laryngeal nerve, superior thyroid artery. Right. Let's come to the base. Now look at the base again. Can you see that there is another artery, inferior thyroid artery, and there is a recurrent laryngeal nerve. Again, close to the gland here, they are very close together. So now we come to the same question. Suppose I am doing thyroidectomy. Where will I ligate my inferior thyroid artery? I would ligate my inferior thyroid artery away from the gland, because close to the gland, the two structures are close to each other. You don't want to damage recurrent laryngeal nerve, students. You don't want to damage it. Okay. So the lesson is ligature of inferior thyroid artery applied away from the gland. Okay. Right. So we've done the apex and base. Let's move on to the surfaces. Okay. Want to take some sip of water maybe? Okay. Right. I'm happy with my apex and base. Let's move on to surfaces. Okay. So here's the surfaces. First, let's understand the surface, then we discuss them. Okay. So here's your superficial surface, posteromedial surface, and medial surface. Three surfaces. Superficial surface, posteromedial surface, medial surface. Posteromedial or superficial surface is absolutely related to the skin and the strap muscles. That means this surface is related to sternohyoid, sternothyroid, omohyoid, superior belly, and the sternocleidomastoid. It's covered by these muscles. How does it matter? Of course it matters. When you try to approach the gland, you're going to have to reflect these muscles away. Otherwise, you cannot touch the thyroid gland. It's covering. Okay? Fine. Let's go to the posterolateral surface. Can you see that this surface is related to your precious carotid sheath? I'm sure you knew that. All of us do. Right. Let's now talk about the medial surface, that is here. Okay. So this medial surface is related to something very unique. Okay. Because of which it gets repeatedly asked. Please note. Two muscles, two tubes, two nerves. Say it once. Two muscles, two tubes, two nerves. How? Let's take a look. So here you are seeing an image. You can see that it's related to two muscles. What are they? Cricothyroid muscle and the inferior constrictor. Can you see both the muscles? Cricothyroid muscle and inferior constrictor. Students, the dotted line that you are seeing is the thyroid gland. Okay. So you can see how the apical region is related to cricothyroid and inferior constrictor. It's related to two tubes. What are the two tubes? Larynx and trachea. Larynx continuing down as trachea and pharynx continuing down as esophagus. So it's related to two tubes, larynx, trachea and pharynx, esophagus. Clear? Now let's go to the two nerves. What have we covered? Two muscles and two tubes. Now two nerves. What are the two nerves? Take a look. External laryngeal nerve, remember we met it earlier, company to superior thyroid artery. Okay. And below here, recurrent laryngeal nerve, we met that also. Accompanying which artery? Inferior thyroid artery. So these are the two nerves, external laryngeal nerve and recurrent laryngeal nerve, which are present on the medial surface of the thyroid gland. So two muscles, two tubes, two nerves. Okay? Right. Let's learn a little bit about these nerves, because we should know what are these nerves, where did they come from, why are they here. These are questions that should strike each one of you. Don't study passively, students. Study because you want to understand. Don't study just because madam has some great enjoyment to teach you all this. No. You need to learn. You need to understand. Okay? Let's get into this. Here I can see my external laryngeal nerve. Here. Okay? See, understand that this external laryngeal nerve is a branch of vagus. So the vagus, which is the 10th cranial nerve, descends down, gives rise to a superior laryngeal nerve. Superior laryngeal now divides into an internal laryngeal nerve, which is sensory, and an external laryngeal nerve, which is motor. Internal laryngeal nerve, along with superior laryngeal artery, pierces the thyroid membrane. Remember the pairing, students. The internal laryngeal nerve, along with superior laryngeal artery, pierces the thyroid membrane and now goes to supply the larynx. We'll not think about it. The external laryngeal nerve, as you can see, comes down to supply the cricothyroid, giving a twig also to the inferior constrictor. Two muscles supplied by the external laryngeal nerve. There is one more muscle. I want you to find out and tell me. Okay, let's see if you can do it. Comment section is always available for you to give me your responses on these questions. Right. So that completes my external laryngeal nerve. Let's now talk about the recurrent laryngeal nerve. Recurrent laryngeal nerve on both sides is branch of vagus. You can see here the right vagus descending down, giving rise to the superior laryngeal nerve. Left also does the same. They are traveling in the carotid sheath, but at the level of the neck, their course changes. Okay, the right vagus gives rise to the right recurrent laryngeal nerve that winds around the subclavian and comes back up in the tracheoesophageal groove. On the left side, however, the left vagus descends down in front of your aorta, giving rise to a nerve that winds around your aorta and comes back up as the left recurrent laryngeal nerve. So that's the difference. Both recurrent laryngeals are crucial nerve supply to your larynx. You really cannot afford to have this nerve damaged. Okay? So that gives us enough information about both the nerves. Let's now talk about one last relation. Recurrent laryngeal nerve lies behind the ligament of Berry, as you can see here. Right. So we've done the surfaces also. Let's go to the borders. There is an anterior border and there is a posterior border. How do I know, ma'am? It's such a soft tissue. How do I know which is the border? Right, it's a good question. You will know which is the anterior border by following the superior thyroid artery. Superior thyroid artery gives rise to an anterior descending branch that runs on the anterior border and then anastomosis with the fellow of the opposite side over the isthmus. So that artery is a very good indication for where is the anterior border of thyroid gland. Okay, let's now see that it also gives rise to a posterior branch. Superior thyroid gave rise to an anterior branch. Now it also gives rise to a posterior branch that goes behind the gland. And here it meets the inferior thyroid artery and they anastomose along the posterior border. So how will I know which is the posterior border? I will look for the anastomosis between the superior and inferior thyroid artery. What else will I find there? I will find my precious parathyroid glands. I will find my precious parathyroid glands. Okay, so these are the glands, as you can see. The posterior border is related to the superior and inferior parathyroid glands. It's very important. We will need it later. Right, so what have we done? Let's quickly revise, students. What we've done is apex and base. We've done the applied of why the gland grows downwards. Where will you clamp the superior thyroid? Where will you clamp the inferior thyroid arteries? Then we talked about surfaces, superficial, posteromedial, medial. Medial, you remember two tubes, two muscles, two nerves. Clear? Okay, then we talked about borders, anterior border and posterior border. Let's now go to the isthmus. We are right there, students, almost the end of the class now. Okay, maybe one more sip of water for you or coffee. Right, let's talk about the isthmus now. So isthmus has got an anterior surface and a posterior surface. Anterior surface is covered by, that's the isthmus. It's covered by sternothyroid, sternohyoid muscles. Enclosed within the investing layer of deep cervical fascia. Within the superficial fascia, you find the anterior jugular veins and the jugular venous arch. Again, you will say, ma'am, why are you giving us all these details? Students, when you are approaching somebody for a tracheostomy. If you don't know this, you're going to damage these structures. Okay. So, and it's such an emergency structure that you really don't have time to study, right? It's such an emergency procedure. You have to know these things in advance. You can't come up at last minute and say, I want to study anatomy now. Okay? So that's why you need to know. Posteriorly, it's related to second, third, and fourth tracheal rings. Borders, there's a superior border and there's an inferior border. Superior border, of course, related to anastomosis of superior thyroid artery. Also, can you see a part projecting upwards? That's the pyramidal lobe, also called the Lalut's pyramid. I won't talk about it now because there's a section on it in the next lecture. Extending from the pyramidal lobe up to the hyoid bone, can you see levator glanduli thyroideum? Fibromuscular structure, okay, are not a remnant of thyroglossal duct. Inferior border shows inferior thyroid veins and shows presence of thyroidea ima artery. So that completes our discussion on isthmus, anterior surface, posterior surface, superior border, inferior border. So now this sheet is very important, students. This gives you the entire stuff that I have covered till now. Just look at it and revise. Okay? So let's see if you really understood something. So following pairing is correct except superior thyroid artery, external laryngeal nerve. Yes, they are present at the apex. Inferior thyroid artery, internal laryngeal nerve. I am not sure. Internal laryngeal nerve, superior laryngeal artery. Remember they pierce the thyroid membrane? Yes. Recurrent laryngeal nerve, inferior thyroid artery? Yes. So what's the correct answer? B, which is the wrong pairing. Got it? So knowledge makes a difference to solving MCQs every time. Okay. Let's now go to medial surface of thyroid gland is related to the following two nerves. I'm not going to read this. I already know the answer. Medial surface of thyroid gland is related to external laryngeal nerve and recurrent laryngeal nerve. Is there that option here? Yes, so that's my answer. Why should I read everything and confuse myself? Once I know the answer, then I may check out the others, but I know the answer. Okay, this is how we solve MCQs with knowledge. Right, so we come to the end of this class 1 on thyroid gland. There is one more class left, students. I request all of you to please attend it. Okay, so finally, an advice from me. What you do is more important than what you say. Say less, do more. I will not say less all the time. In Viva, do say what you know. There's no option there. But if you want to say, also back it up with a good amount of doing, isn't it? Alright, so I had a great time taking this class, students. I hope you enjoyed it too. Do keep studying, alright, and see you in thyroid gland too. Thank you.